afternoon, wherever you're watching us from. Welcome to the digital event, Lessons Learned on Pandemic Preparedness, Response and Recovery, launch of a new pandemic preparedness report. This event is organized by FIP, the International Pharmaceutical Federation, the global body representing pharmacy and pharmaceutical sciences. Following the pandemic, how to continue to lead the profession globally and to support our members during these uncertain times became a core priority for FIP. And as we move from responding directly to COVID-19 to responding to the aftermath and to readying ourselves for future pandemics and health emergencies, today we derive key lessons, recommendations, and considerations for the future in another report, Pandemic Preparedness, Response and Recovery, Lessons Learned for Global Pharmacy, which will be launched at today's digital event. If we go next. My name is Farah Aqqad. I'm FIP's Regional Engagement, Support and Development Manager, and I will be the moderator for today's event. I would also like to introduce the co-moderator, Dr. Sherly Meilianti, FIP's Data and Intelligence Specialist. Before we start, we have some announcements. We would like to inform you that this event is being recorded and will be accessible at the FIP events website. You can visit www.events.fip.org to watch this event again or to explore other FIP events. We also encourage you to send us your questions or comments throughout the Q&A box. Our panelists and speakers will try to answer as many as possible during today's session. Thank you again for your participation and your interest in this session. Before we proceed, we would like to acknowledge and thank our sponsor for this event. This webinar is sponsored through unconditional funding by Pfizer. We have an exciting and informative agenda for you today. So let me give you a brief overview of what we will cover in the next hour and a half. We've already started with the introduction to the event. We will present our speakers and panelists. We will also share the objectives, aims, and outlines of the event. We will then move to a presentation by my colleague Sherly, the event co-moderator, who will give us a summary of the previous FIP work on the global pharmacy pandemic response and the contribution of the profession on COVID. As part of our third agenda item, we will launch the new FIP Pandemic Preparedness Report. Our team will present the report structure and outline, and we will also showcase some of the initiatives and case studies on pandemic response from selected FIP member organizations. We will invite our member organizations representatives to share their insights on lessons learned and follow-up questions. We will also introduce you to the digital supplement that complements the digital report. Then we will have a keynote presentation by Dr. Caitlin Watson, the founder and CEO of Disaster Pharmacy Solution. Then we'll have an audience engagement activity where we will ask you to participate in a Mentimeter activity related to the event topic. So in the chat box, we will share with you the link so that you can join and add your responses as we go through the event. And after the presentations, we will get back to your responses and we will present the results, the collective results that came from your end. Finally, we will have a panel discussion with representatives from our FIP member organizations and our keynote speaker as well, who will share their views and challenges on the pandemic response. And then wrapping up with closing remarks. So if we move to the next slide, we have 9 representatives from our member organizations from Costa Rica, India, Ireland, Japan, Lebanon, Malta, Portugal, and South Africa. We will introduce them in more detail as we move through the event, but please note that we will share the biographies of all panelists and speakers in the chat box for your reference. If we go next. So our primary aim today is to launch our new report, Pandemic Preparedness, Response and Recovery, Lessons Learned for Global Pharmacy, which documents and analyzes the lessons learned from the COVID-19 pandemic for global pharmacy and provides recommendations and considerations for enhancing pandemic preparedness, response, and recovery. We'll also highlight key findings and reflections of the report, including pharmacy's role in pandemic readiness, challenges and opportunities faced during the pandemic, and implications and recommendations for pharmacy in pandemic recovery. Our discussion, of course, will be enriched by a panel of esteemed representatives, our MO representatives from different regions, and our keynote speaker, as I mentioned earlier. If we go next, as we mentioned, we have an engagement activity with you, our audience, and we invite you to write 3 words that describe the impact of pharmacy on pandemic preparedness. You can use the link that we will share in the chat box or scan the QR code on the screen. For example, you could write educational, supportive, responsive, adaptive, and we will leave it to you to add more responsive, and we'll get, as I mentioned, we will get back to the results after the presentations. On the next slide, I will now hand it over to my colleague Sherly to present an overview of previous FIP work. Sherly, the floor is yours.
Thank you very much, Farah. Good day, everyone. In the next few slides, what I will do is I will be sharing an overview of our previous report, which is the global response of pharmacy to the pandemic, the contribution of the profession to COVID-19. This report was launched last year in October 2022 to mark the 1,000 days since the World Health Organization declared the new coronavirus as a public health emergency of international concern, which is in January 2020. This report described the response of the global pharmacy profession during the COVID-19 pandemic, taking the timelines as 10 blocks of 10 blocks of 1,000 days. And FIP presented its effort by highlighting the action taken by the Federation since 30 January 2020. And this involved like many things, gathering global expertise, promoting international solidarity among professionals, and also facilitating prompt action at the national level. This report primarily focused on 2 significant aspects, which you can see in the box below. So it is focusing on what FIP has done to respond to the COVID-19 pandemic in order to support our members through the pandemic. And also the second aspect is about our member organization, what our member organization has done to respond to COVID-19, which we gathered to 2 forms, which is a global survey on pharmacy response to the pandemic, and also related to the case study shared by our member organizations, which highlight the leadership strategies and also initiative from our member organization, which we will also be sharing again today. And my colleagues will share again the link of the report to the chat box, so you can see again what the report is about. This slide is about the FIP response to the pandemic, where we highlight in our report, we develop activities that include many things related to providing evidence-based technical and professional guidance to our members and also to the entire profession. And we also advocate for pharmaceutical scientists, pharmacists, and also pharmaceutical educators to contribute to the profession, to ensure their safety and also for them to be recognized appropriately as well. Our response strategy can be categorized into 10 themes, which you can see as a row in this figure. And also these themes are gathered into 4 broad strategic response area, which is column in this figure. And the broad area includes supporting international solidarity and our members, advocating and showcasing the impact of the pharmacy profession in responding to pandemic, gathering data, science, and innovation, and also adapting our business and ways of working. These 10 themes you can also explore further in our report, in our previous report. And these initiatives include establishing like a comprehensive COVID-19 hub, implementing a pandemic preparedness program, advocating pharmacy-based vaccination delivery, strengthening partnership and collaboration, and delivering digital programs to address the challenges that we face during the COVID-19 pandemic. Moving on to the global survey itself, we collected data from October 2021 to February 2022, where we asked member organizations to detail their initiative, their activities, and also their outputs during the COVID-19 pandemic per 100 days. In here, we also asked member organizations to share with us the pharmacist's role during COVID-19 and their main challenges, priorities, and support. And we gather a total of 52 member organizations across 42 countries and territories, and also all WHO regions, where this highlight a diverse response of this national organization. And their initiative also include a lot of area, such as developing and updating clinical guidance, implementing public education programs, providing education for healthcare professionals to ensure the availability of essential medicine and PPE, personal protective equipment, to support diagnostic testing and vaccination within pharmacy, promoting scientific research, and also advocating for the legal change to facilitate the pandemic response. As we gather information per 100 days, this slide illustrates a little bit about general themes of the activities per 100 days. Of course, the themes vary across member organization. However, this provides a general idea about what member organization did from the beginning of the pandemic till 700 days. Member organization responded to us saying that they initially reacted to the pandemic by developing a clinical practice guidelines for their members. And these guidelines were then disseminated to the member organization via educational webinars and digital events. And also many member organizations coordinated with government to ensure medicine supply and COVID-19 diagnostic test kit supply as well, where pharmacists had an active role. This is also followed by vaccination advocacy and digital events to promote the importance of vaccination to the society. And in some countries, member organizations also start lobbying and expanding pharmacists' role in vaccination. And also they keep the guideline to be updated and to support their members in practice and to conduct science and research activities and vaccination advocacy. Despite many challenges that reported by our member organization, they describe that international solidarity and collaboration are very important in supporting them in tackling their challenges. And this can be done by sharing resources and learning from other member organizations. So, building on this previous report, it is important for us to also produce a report on lessons learned from COVID-19 to better future pandemic preparedness, response, and delivery. And that is why I would like to invite my colleagues today, Dr. Lina Badar, FIP Lead for Equity, Sustainability, Policy, and Development, to share with us our new report about pandemic preparedness, response, and recovery. Lina, the floor is yours.
Thank you very much, Sherly and Farah, for setting the context for our special launch today. I'm very excited to be launching with all of you together with us today our new report on pandemic preparedness, launching just now. Our report is titled Pandemic Preparedness, Response and Recovery, Lessons Learned for Global Pharmacy. Building on what my colleagues have said, just as a reminder, of course, we know that the COVID-19 pandemic taught us all to learn to adapt to circumstances, not only as an organization as FIP, but of course as a wider profession. How to continue to lead the profession globally and support our members during these times became a core priority for FIP, and thus the birth of this entire program on pandemic preparedness. But as we hopefully move on from responding directly to COVID-19 and to its aftermath, we are now readying ourselves for future pandemics and health emergencies. Thus, we sought to derive lessons and key recommendations and considerations for the future. Sherly has presented a summary of our 2022 report, and you may consider that more of a reflective account of how we responded. This new report focuses on lessons learned and could be considered a more prospective, forward-looking document. Together, these reports and all of our resources on the topic combine to support the global profession in the area of pandemic preparedness, response, and recovery as part of a global health workforce team. The key learnings for pharmacy are presented in this report in 6 key sections. And I know my colleagues will be entering the link to the report shortly in the chat box, so you can access that and view it while I briefly cover some of those sections. So the first one is leading by example, governments, nations, and member organizations. This section draws on 11 country case studies with each focus on a strategic initiative the member organization implemented in the wake of the pandemic, focusing specifically on the lessons learned from these initiatives as the countries have reported them. And later on today, we'll hear from some of these countries live about some of their lessons learned and where they got to since then. Another key section focused on enabling system transformation. This covered remuneration, regulations, and data infrastructure for vaccination services. This section really focuses on how we can accelerate transformation for pharmacy-based vaccination post-COVID-19. Here we point out 3 key policy enablers for pharmacy-based life course immunization. One is vaccination services remuneration and its models. Another is regulations and prescribing authorities. And the third enabler area is access to data and patient vaccination records. The third section, investing in science and innovation, vaccine development, misinformation, and hesitancy. We all know that investments in science and innovation will only strengthen the overall response to future pandemics and help ensure more effective and equitable distribution of vaccines to protect public health. By incorporating the lessons learned into future pandemic preparedness strategies, policymakers, healthcare systems, and pharmacy professionals can better equip themselves to navigate the challenges associated with vaccine development, misinformation, and hesitancy, which we describe in this chapter. The fourth key area or section considers reshaping pharmaceutical practice and identifies new trends for the profession post the pandemic. This section really summarizes excellent piece of work conducted by the FIP Board of Pharmaceutical Practice between 2021 and 2022. They published a trend analysis report amid the pandemic. The report offers insight into the main trends that will impact the future of pharmacy in all of its practice settings. It provides a roadmap to the leaders of FIP member organizations and valuable strategic tool and serves as a strategic tool to derive change at a local level. This section in this new report summarizes some of those key findings. The fifth area, accelerating universal health coverage, equity, access, and sustainability of vaccines, medicines, and services. As the title really entails, we describe how 3 pillars of equity, access, and sustainability are key to successful pandemic preparedness response strategies. Last but not least, the 6th section focuses on transforming the workforce preparedness and resilience. We focus here on the workforce and highlight the importance of investing in their education and training, including surrounding vaccination services, prioritizing the safety, well-being, and resilience of the workforce, and also understanding the intricate links between gender in the workforce and pandemic response. It's important to say here that these areas, the 6 we've identified, are by no means exhaustive. Lessons learned from the pandemic span many, many topics and touch on many aspects of the profession that can't be captured in one report. However, we choose some of these challenges presented here. They are supported by data that FIP has gathered and programs that we've delivered, and these can be considered priority learnings for pharmacy that can be built on in the future. The report concludes with 6 areas and 6 concluding commitments. To advocate for the role of pharmacists in pandemic preparedness, to support the profession during disasters and pandemics, to enable the workforce to deliver quality care during pandemics, to call for policy development transformation, to utilize data and surveillance, and to provide global guidance to members worldwide. Each of these 6 concluding commitments are expanded on in the full version of the report, so we really recommend you to have a look at that. I also mentioned that this report is accompanied by a digital supplement on pandemic preparedness, response, and recovery, which collates key resources from the global health community, other health professions, and key research outputs. This will be presented in a few moments by my other colleague, Nour, so I'll leave that for her. To conclude this official launch section of today's event, I'd like to end with some remarks from our FIP CEO, who couldn't be with us today, but did send these notes to share with all of you. FIP continues to play a pivotal role in advancing the pharmacy profession and promoting global health. We are committed to providing pharmacists with timely and relevant information to navigate the evolving landscape of healthcare challenges, including pandemics, so that they can continue to be at the forefront of safeguarding public health. Thank you so much, and I'm going to hand over to Farah. Thank you.
Thank you so much, Lina. We'll now take a moment to present the insightful case studies from our member organizations. As we mentioned, we have representatives from various MOs to address follow-up questions and share some insights, but the details of these initiatives are also outlined in our pandemic preparedness report. So if we move forward, we have the first case study. We'll start with the College of Pharmacists of Costa Rica. In January 2020, they launched a project on pharmaceutical services in immunization, which was adapted for COVID-19. Their efforts included addressing vaccine concerns, informative campaigns, and COVID-19 training for pharmacists. Despite concluding this initiative in December 2022, the college plans to persist with educational programs and guides, noting positive outcomes from training and campaigns, despite lacking impact measurement tools. The challenges included media presence and the Ministry of Health collaboration, leading the college to consider broader public health projects involving more stakeholders and engaging pharmacists in varied activities for ongoing service improvement. I'm honored to welcome Professor Sofia Segura, who's here representing both the University of Costa Rica and the College of Pharmacists of Costa Rica. Sofia, if you can please join me on screen.
Okay, thank you.
Thank you, Sofia. So our question today, our follow-up question today is, how did you adapt this project on pharmaceutical services and immunization to respond to the COVID-19 pandemic? And what were the main challenges and opportunities that you encountered in doing so?
Okay, thank you so much, Farah. Good morning, good afternoon, and good evening to everyone. And well, I have to start saying that the project of pharmaceutical immunization services from community pharmacies is an initiative of the College of Pharmacists of Costa Rica, which is the country's professional organization advocated to the progress of the pharmacy through actions related to professional development, articulation with national and international stakeholders, and the supervision of the professionals and pharmaceutical establishments according to law. The project began in January 2021 with the main objective to develop tools that would promote the pharmaceutical immunization services from the community pharmacy, to improve national vaccination rates and so contribute to public health in Costa Rica. To comply with this, 6 specific objectives were defined, aimed at improving knowledge to provide immunization services from the community pharmacies, inform about the role of the pharmacist in the immunization process, and systematize the contribution of community pharmacies in vaccination rates, specifically influenza. I have to say that traditionally in Costa Rica, different actions related to immunization can be carried out, such as informing, advising, recommending, administering, and registering vaccines in community pharmacies. However, it was necessary to strengthen even more these services through strategies that promote the inclusion of more establishments. Now, with COVID-19, and given the importance of vaccination as a tool to control the pandemic, the objectives related to information campaigns and the development of educational activities aimed at pharmacists were redirected to focus them on the needs that our national reality demanded. This in accordance with the global situation and the need to support the measures undertaken by health authorities. And now we have some results about this adaptation. As regards information campaigns for the population, 4 campaigns were carried out. The first one related with the importance of getting vaccinated against COVID-19. The second one related with the importance of getting vaccinated against influenza. The third one related to importance of sanitary measures in the fight against COVID-19, including vaccination. And the fourth one was about the importance of vaccination in the pediatric population. Likewise, 8 educational activities aimed at pharmacists related to vaccination by COVID-19 were carried out, including pharmacology of the different vaccines, regulatory aspects, storage, pharmacovigilance, vaccination against COVID-19 in special populations, and importance of vaccination of influenza in the context of COVID-19. It should be noted that the other proposed objectives that seek to increase knowledge and research about the actions carried out by pharmacists in terms of vaccination were also met. So, the contribution of the actions carried out is recognized, and we made it. We got adapted to the situation, and that proved the feasibility of continue working on this subject. However, the impact of the project remains to be determined, since its formulation considered only quantification of results. For this reason, it is proposed that a second part, and this is our main challenge, that a second part of the project should address strategies to measure the impact, the real impact in the society about these actions. Thank you so much, Farah.
Thank you very much, Sophia, for the comprehensive response. We will now move to the next initiative, which is basically the initiative that will be shared by representatives from Indian Pharmaceutical Association. Indian pharmacists play a crucial role during COVID-19 by conducting awareness programs based on national and WHO guidelines for proper medicine handling in patients. Their frontline advisory role highlighted their significance in healthcare, despite challenges like supply chain disruptions. Lessons learned include the need for awareness campaigns, drug supply management, countering misinformation, and disaster training. The Indian Pharmaceutical Association aims to strengthen the pharmacy profession's healthcare role. And it is my pleasure to introduce Professor VSP Fadlamudi, the immediate past president, Indian Pharmaceutical Association from India. Professor, if you can open your camera, please, because I would like to ask a follow-up question to you, if you are okay with that. Professor, can you?
We can see him, Sherly. He's on camera.
Okay. Well, thank you so much, Farah. Thank you so much. Yeah, our question is about how did you collaborate with other stakeholders in the healthcare system, such as doctors, nurses, regulators, and policymakers, to ensure the optimal delivery of pharmacy services during the pandemic? The floor is yours.
Thank you, Sherly. Thank you, Sherly. Good afternoon, good morning, good evening.
Apologies, Dr. Rowe. I think if you can disconnect your speakers and try to fix your audio, because we cannot hear your voice.
Can I hear my voice?
We can hear it, but it's very low. If you're connecting via like a headphone, if you can disconnect that from your PC, and we can try again.
Can you hear me now?
No, still can't hear you. Apologies.
Can you hear me now?
Yes, we can. But if you can just try to stay close to your microphone, because your voice is a bit low. Thank you so much, Professor Rowe. Sherly, let's follow up with Professor Ro, and I think we can move forward with the next case study and then get back to India.
I agree. Yeah, go ahead.
Thank you. Thank you. So moving forward, we have our speaker from Ireland. So our next case study is from the Irish Pharmacy Union. The Irish community pharmacies played a crucial role in COVID-19 vaccination efforts by using their skilled workforce and network, supported by IPU, the Irish Pharmacy Union, and the Health Services Executive, HSE. This collaboration introduced HSE PharmaVax, which is a vaccination platform, enhancing efficiency and data recording. Challenges were of limited vaccine supply, and logistical obstacles were overcome through resource support and dedicated hubs, showcasing community pharmacies' importance in healthcare and promoting collaborations for future advancements. So let's hear it from someone who was at the forefront of this initiative. I would like to welcome Susan O'Donnell, Professional Services Pharmacist. If you can join me on screen, Susan. Our follow-up question is, how did you evaluate the impact of community pharmacy involvement on the vaccination coverage, the health outcomes, and the satisfaction of the public and the pharmacists?
Hello, everyone. During the pandemic, community pharmacists helped to develop and design a central vaccination portal with the HSE IT team. This is called HSE PharmaVax, and this linked into the central COVAX system, which was used by the other vaccination channels. When pharmacists use this system, they would designate the risk group, the population profile, as well as the vaccine type in the series. This allowed the population dynamics to be developed that informed public health officials on which target groups had yet to present for vaccinations, so more targeted public health campaigns could be developed. This system also indicated which groups were choosing which channel to be vaccinated within, and as the vaccination service fully developed, more and more of the members of the public were choosing a pharmacy as a vaccination destination. We participated in a key stakeholder vaccination group, which included the HSE and our regulator, the PSI. This focused around planning for the COVID-19 vaccination programme. Emerging plans will be discussed and current campaigns were reviewed as part of these meetings. These meetings were weekly when required and transitioned to bi-monthly when the campaigns were running smoothly. All statistics were reviewed at these meetings, including population uptake and rate of vaccinations in the various channels. In Ireland, there is roughly a population of 5 million. 12 million vaccines have been administered as part of the COVID-19 programme to date, and pharmacy has delivered 10% of the vaccines since the programme began. Interestingly, for the year 2022, when pharmacy was fully engaged in the programme, they delivered 23% of all vaccines administered over all channels. There are also relationship managers employed by the HSE who contact vaccination providers to establish their feedback. The IPU provide a suite of supports to vaccination pharmacists, which include a service to answer queries via email and phone calls. This often highlights dissatisfaction within vaccinators and where support materials may be falling short. We can then provide additional information on these topics, and we feed back to the stakeholder meeting on these matters to ensure they're addressed. Currently, the pharmacy regulator is conducting a survey to understand public opinion of vaccination programs in community pharmacies. Our own public survey ran in May 2023 indicated that 86% of the population are happy to receive a vaccine in their local community pharmacy.
Thank you very much, Susan, for the response. It's very comprehensive. Just to let the audience know that Professor has a little bit of technical difficulty, so we'll come back to India later on when he comes back. Okay, we'll now move on to hear from Japan, where the Japan Pharmaceutical Association shared their initiative to us. During the COVID-19 pandemic, the Japan Pharmaceutical Association provided remote guidance and medication delivery to ensure continuous therapy and reduce infection risk. This ongoing initiative includes government financial support, but there are some challenges related to funding and how to keep pharmacies safe. The lesson learned emphasizes the need for robust local plans to ensure medicine supply during the emergency. And it's my pleasure to invite Nobuo Yamamoto, the president of Japan Pharmaceutical Association. I can see that President Nobuo is already on the screen now. Thank you so much for sharing your video. And my follow-up question would be, how did pharmacists in Japan ensure the quality and safety of the medicines delivered, especially those that required special storage and or handling conditions? The floor is yours.
So, thank you, Sherly. So that concerning that how to control the quality of medicine to supply to the pharmacy to the patient home. So some cases directed to bring in the pharmacist to the patient home, but some cases in the sending the post office or someone. But we wondering that how to control the temperature or control the medicine. So in very important issue, so that difficult to do. So, but in many cases in the pharmacist in the pharmacy near here to the pharmacy patient home and bring them and put on that green box and anyway. So we believe that to 2020 and after 2020 and now in estimated 3 years, it is successful in supply to the medicine in the patient to the pharmacy and continuing the medication therapy. Thank you.
Thank you, Professor Nobuo. Thank you for the incredible insights. We'll now move forward to our 5th case study from Lebanon, from the National Institute of Public Health, Clinical Epidemiology and Toxicology. In Lebanon, an initiative aimed to study COVID-19 and economic crisis impacts despite the absence of national guidelines. There was an independent research addressing various issues, including drug shortages and long COVID predictors. Despite challenges like collaboration issues and data access, resulting publications influenced policymaking, promoting the development of national pharmaceutical strategy, and emphasizing the importance of preparedness and research in the absence of strong institutions. With us today is Roni Zini, who's the Medical Center Director of the American University of Beirut, AUB. Welcome.
Thank you so much, Farah. Good morning.
So our follow-up question to you, Roni, is how did you manage to disseminate your research findings and your recommendations to relevant stakeholders such as policymakers, healthcare professionals, and the public?
Thank you so much. Good morning, evening, and for everyone joining us today. It's such a great pleasure to be here. Eventually, INSPECT played a major role during COVID, particularly that when it all started, whether professionals and the public lacked the right knowledge, and definitely we all remember that propagating of the misinformation had been all over the media. So INSPECT used the platform of research in order to be able to educate pharmacy and general public about facts and correcting misinformation and redirecting the practice. And this has been magnified, and the role has been really well valued in terms, especially that during that time, things were not very clear, and things internally in Lebanon, we didn't really have a body that governed the information and regulating the information and creating local guideline and standard of practice. So having this being said, even after the pandemic of COVID, INSPECT have worked hand in hand with the Order of Pharmacists of Lebanon in order to joint effort to come together in a conference and put everything we know in order and bringing together all stakeholders to come up with a national health strategy. And this has involved various stakeholders, including policymakers, the government, the pharmaceutical companies, and definitely health professionals. And things went back to the implementation part, yet we all know that Lebanon is and continue to be facing a huge financial problem, which definitely has hindered the implementation of the strategy that we have put in place. Along the same line, Inspect has continued to work on the all health sector component, including all disease states, and recently has launched the impact of modern pharmacy concept on therapy of patients in Lebanon, and is mainly to target the new concept of community pharmacy and its role. And this is in 3 phases, and this has started to be implemented. So eventually, what did we learn from the whole thing during the past period? We learned that we definitely, since we were lacking or we have a gap in national research strategy, Inspect has been trying to fill in the gap. This is one. We definitely have an issue or critical need in strategic thinking across the whole country. And finally, we definitely need to make sure to introduce disaster preparedness across all modules, including the practitioner, but also the early career practitioners. Thank you so much.
Thank you very much, Ronnie, for the comprehensive answer. We will now move, and also for sharing the new model developed in Lebanon as well. Thank you so much. And we will now move to the next initiative shared by Malta Chamber of Pharmacists. During the COVID-19 pandemic, an ongoing initiative in the Pharmacy of Your Choice national scheme focused on paperless collaborative repeat prescribing and dispensing. Pharmacists were granted the authority to repeat dispense medications, ensuring uninterrupted access to medicines and treatment. There are some challenges which include pharmacist acceptance and collaboration issues. The key lessons learned highlight pharmacist adaptability and the necessity for ongoing collaboration for successful implementation. This initiative remains a work in progress, aiming for optimal implementation through workshop and service integration. And I would like to invite President Mary-Ann Sanfournier, the President of Malta Chamber of Pharmacists, to join me to the screen. Okay, I can see she's in the screen already now. Welcome.
Yes, I managed that.
Thank you. And the questions that we would like to ask is about one of the challenges that you faced was the acceptance by some pharmacies of the new dispensing authority. How did you address this challenge? And what strategies or incentives did you use to encourage pharmacies to adopt this new practice? President, the floor is yours.
Thank you. Good afternoon or good evening. So as you said, the pharmacists were given this acquired authority through the Chamber's initiative and acceptance by the authorities. It is considered an achievement, of course, in the development of pharmaceutical care practice. And the state's intention is, of course, of not going back, but forward, enhancing and entrenching such authority in the legislation. Of course, ensuring that it is seamless and closing any remaining loopholes. This is the challenge, to satisfy some remaining pharmacist qualms in embracing the development by enhancing their awareness of their competency to actually actuate it. In our small community scenario, Malta being, as you know, a very small island nation, a health individual rapport has been built over the years with our membership base. A one-to-one, sometimes via emails, also calls, small group webinars, etc. All true, and since we implemented this development during the COVID days, as from March 2020. And in implementing and continually upgrading the POIC national scheme, in particular the continuous and ongoing representations at policy-making level, we did development of specific digital tools in support of professional and clinical practice. And this gives the pharmacists a better environment to feel that they can dispense repeat prescriptions with in a safe way. And also the incentives come from the negotiated 5-year contracts we've done for to date since 2007 by the Malta Chamber, which consolidates the protocols of this initiative. In fact, it's in the appendix of the latest SLA, and also the development of MURs, which we believe also consolidates this practice. Working with primary healthcare doctors and with the private doctors organizations, we are fine-tuning the protocol, with respect to, excuse me, issuing a prescription at the pharmacist's request, for example, after a 6-month review referral, introduction of new treatment, or withdrawal of existing treatment, or, for example, a change in dosage or dosage regimens. Thank you.
Thank you so much, President Meilianti, for the comprehensive response. We're now moving forward to Portugal, and our first case study from Portugal is from the National Association of Pharmacies. In Portugal, an ongoing initiative introduced rapid antigen testing for SARS-CoV-2 in community pharmacies with NHS referral. The aim to enhance testing capacity, detect cases early, and respond to outbreaks efficiently. There has been over 12 million tests performed by half of the pharmacies, improving testing access and reducing disparities. And though challenges like pharmacy registration and how remuneration were actually faced. The initiative emphasizes the role of pharmacies in bridging gaps and underlines the need for structured communications and proper compensation for services while demonstrating positive health outcomes and healthcare system sustainability. With us today is Nour Eltahla, Executive Director of the Center for Medicines Information and Health Interventions. And I would like to ask you to go on screen, please. I can see you're on. Our follow-up question is, how did you monitor and evaluate the impact of implementing rapid antigen testing for SARS-CoV-2 in community pharmacies? And did you use any indicators for that?
Thank you. Good morning, everyone. Thank you, Farah. Responding to your question, as part of the Portuguese response to the pandemic, community pharmacies were authorized to provide SARS-CoV professional rapid antigen detection testing service to the population. In November 2020, with the professional, regulatory, and technological support from the National Association of Pharmacies, pharmacies started to provide a 100% reimbursed rapid antigen testing service to the population, namely through partnerships with local and regional authorities and subsequently with the National Health Service. By September 2022, about 1,650 pharmacies in Portugal provide the rapid antigen detection testing, which is more than 50% of total national pharmacies. About 13 million tests has been performed by pharmacists, corresponding to 68% of the total tests performed in our country. To provide an overview of the rapid antigen testing service provided by Portuguese community pharmacies and their overall performance, we conducted several observational studies using COVID-19 open access databases and pharmacy dispensing databases. The pandemic strengthened the role of community pharmacies as healthcare provider, highlighting their capillarity, response capacity, and value as a part of the health system. Thank you so much.
Thank you so much, Ruth, for sharing the first initiative from the Portugal, from the National Association of Pharmacy. We are now moved to the second initiative, actually from the Portugal as well, from the Portuguese Pharmaceutical Society, where the Portuguese Pharmaceutical Society partnered with sectorial associations to establish a help desk for pharmacies during the COVID-19 pandemic, offering support to a helpline and volunteers database. This initiative provided technical assistance, information materials, and guidelines to improve health literacy among pharmacists. Collaboration and accurate information dissemination proved to be successful, although challenges initially stemmed from limited COVID-19 knowledge. Lessons learned include the importance of monitoring outcomes and conducting project reports to assess impact, showcasing the value of collaboration in crisis support and communication enhancement. And it is my pleasure to welcome Carla Diogo, the professional affairs from the Portuguese Pharmaceutical Society. And I can see her camera is already on. Thank you, Carla. Welcome. And the question that we'd like you to answer is about how did you collaborate with the various sectorial associations and specialty boards involved in this initiative, and what were the benefits and challenges of this partnership? The floor is yours, Farah.
Thank you, and hello everyone. So during the pandemic, there were numerous documents produced to support pharmacists to practice according to the best standards. And for example, it was developed procedure protocols, contingent plans, specific training like webinars, and compilation of updated scientific data. In the beginning, considering how little information was available about COVID-19, it was difficult to outline a strategy involving so many different entities. Nevertheless, as more information on the subject started to appear, all associations and specialty boards involved focus on their area of expertise, and a robust structure that would truly support pharmacists was concretely assembled. The most frequently asked questions concern, for example, a technical question related to COVID treatments, to vaccination, individual protection, or even about contingent plans implemented. With the INF collaboration, it was possible to address the pharmacist questions in a useful time. For example, in a partnership with the Portuguese Psychologist Board, it was possible to ensure specialized support to intervene in crisis situation, providing brief psychological counseling to pharmacists. And also there was the need to reduce people's visitations to hospitals to collect their medication. So the Operação Luz Verde, or the Green Light Project, was implemented. This initiative allowed hospitals outpatient treatments being dispensed in community pharmacies. So the helpline provides the link between the hospital and the community pharmacies. So a large volume of calls concern this service. The helpline is no longer available, but had an amazing success among pharmacists. And the help desk improved the communication between pharmacists and make them feel well informed to better help other people. Thank you.
Thank you so much, Carla, for the comprehensive response. Before we move back to Rao, we will have the case study from South Africa. During the early stages of the COVID-19 pandemic, the Pharmaceutical Society of South Africa addressed the lack of information by organizing webinars covering essential topics for healthcare professionals. These webinars were accessible through PSSA's existing platform. It provided a convenient way for members to access continuing professional development, CPD, particularly for those in rural areas. So over 30 months, 60 webinars attracted thousands of attendees and highlighted the importance of standardizing information templates and offering dry run sessions for speakers, while staff dedication ensured successful event coordination despite challenges in timing and preparations. I would like to welcome Jackie, the Chief Executive Officer of the Independent Community Pharmacy Association, ICPA, also representing the Pharmaceutical Society of South Africa. Jackie, welcome. Our follow-up question is, how did you measure the impact and effectiveness of these webinars on the professional development and practice of your members?
Thanks very much, Farah, and hi there to everybody across the world. So in March 2020, South Africa went into a hard lockdown, and this was unprecedented, as it is for many countries. And what happened was there were basically three types of facilities that were allowed to remain open. And those were supermarkets for essential goods only, banks, and pharmacies. Hospitals were open, but it was only for emergencies. The doctors went online, so there was telemedicine. Doctors were not open, which presented pharmacy with an absolutely unique opportunity to showcase our value in healthcare. The problem was that it also put tremendous stresses and strains onto our pharmacies. They were open, they were incredibly busy, phone calls, queries. We became the only source of really readily available medical help out there during this hard lockdown time. And the way that we, as the PSSA and ICPA, addressed the situation was to have these webinars. It became the lifeline for our pharmacists to get information, to make sure they were compliant, and to help them in these very
I think we've lost Jackie, Sherly.
Yeah, I think so too.
Yeah,
So
we've lost her.
perhaps Farah move on to Ro.
Of course.
Yeah. Welcome back, Ro. Could you turn on your camera so we can see you? Oh, that's good. Welcome back. And perhaps what we will do is just to mention again the questions that we have. I think we still have Robbie, right? Yeah. To mention the question again that we have. So it's about how did you collaborate with other stakeholders in the healthcare system, such as doctors, nurses, regulators, to ensure the optimal delivery of pharmacy services during the pandemic? The floor is yours, Rob.
Thank you, Sherly, and I'm terribly sorry for that.
No problem.
Break because of power outage. You know, strangely, it happened exactly 1 year ago when I was participating in a FIP event. I don't know whether it is connected that way. Okay. Indian Pharmaceutical Association during 2020, particularly during the huge lockdown that has started in March in India, we looked at the scenario and we realized that we need to work through our various branches and divisions in actually educating the government and the regulators regarding maintaining supply chain, because it has a huge pharmaceutical industry, and because of the pandemic, you know, transportation across country, across states and across cities came to a standstill. So that is where we started really advocating that in order to maintain essential medicine supply all across in the country in various pharmacies, you need to continue to produce. Even the president of the Indian Pharmaceutical Association participated in talking over TV and in other discussions with various stakeholders and emphasized the role of maintaining the supply chain. And in fact, that led to the government opening up borders for essential movement of essential medicines and raw materials to pharmaceutical industries, such that the medicine supply, essential medicine supply, continued. Our branch, our association members working in various state and local branches and as regulators really work day and night to ensure that pharmacies are kept open and pharmacists are provided with all information that is necessary for them to stay alert and continue to supply medicines as COVID warriors. In the process, a few of the pharmacists have lost life also, but we really, you know, supported their families and also, you know, worked through the government. And we have advocated the role of pharmacists to the government, that the ministers and other people started to publicly on the social media commending the role of pharmacists, you know, as true warriors during the COVID, you know. This way, we have also advocated to the government regarding the importance of pharmacists as a vaccinator. And we also involved FIP. We requested President Dominic Jordan to write a letter to various countries. In fact, he was writing to various countries, you know, and then we got the letter, and then we supported that letter with the IPA letter to the ministers about the importance of pharmacists being vaccinators. And then we obtained an order from the government that the pharmacists can be, you know, are also recognized vaccinators. And then we also worked with FIP to set up training programs to make pharmacists trained as vaccinators. Now, these are various ways in which IPA worked with its stakeholders, policymakers, probably we did not really work with doctors and nurses, but we continue to work with all the policymakers and regulators to ensure pharmacy services are intact during the pandemic, providing services to the public, the people in need. Thank you very much.
Thank you very much, Rao, for the insightful response. I can see that Jackie managed to join us again. Jackie, are you online?
Yes, sorry about that.
No worries at all.
I'll
hand it over to you and just you can repeat the reply to the question.
Certainly. So I was saying that there were a few measures. This lifeline, which was the webinars, giving correct information to our pharmacists and our pharmacy staff. So on the quantitative side, it would be things like measuring the number of attendees, the number of views of the recorded sessions, the number of questions asked, the number of documents that were accessed, and the number of responses to information requests. On the qualitative sides, there are always surveys following any webinars. We could measure the value and the contribution from these. There was also used in the webinar were people contributing towards the development of guidelines. And I think the quality and quantity of the guidelines and standard operating procedures that we were able to put together is also a very good measure. And then lastly, part of what we did in the webinars was to call for pharmacies to test for COVID and to vaccinate. So I think another indicator of the impact was the number of pharmacies that did become vaccination sites and the number of vaccinations that our pharmacies gave. So in the private sector, pharmacies were the main driver of vaccinations. And as pharmacies, we delivered over 7 million vaccines. We were also ensured a constant supply of medicines. Right in the beginning, there was panic buying. And through webinars and instructions, we conveyed information to pharmacies to rather limit the supply of medicines to ensure equitable access to medicines and that we didn't run out. And I think the other thing was that we really looked at the compliance to a number of laws and legislation that was constantly changing. So I think all in all was also the feedback from the pharmacies where they were so grateful for the information that we were sharing. Thanks very much.
Thank you so much, Jackie, for the comprehensive response as well. Thank you. And now we will move. That's actually the end of our share initiative, and we will move now to the next part of the webinar, which is where I would like to introduce my colleagues, Nour Eltahla, the FIP Project Coordinator for Equity, Sustainability, Policy and Development, to share with us the new digital supplement that we launched today. Nour, the floor is yours.
Hello, everyone, and thank you for joining us today for the launch of the new report on pandemic preparedness, response, and recovery. FIP's work on pandemic preparedness, which was a cornerstone of the FIP sustainability portfolio since 2021, will continue into the future to support FIP's humanitarian and disaster and emergency management program and can be found on the FIP humanitarian website shown here. All of our work on pandemic preparedness can now be found under the Activities tab, as you can see on the screen. On our pandemic preparedness page, you will find an overview of our work as well as our publications and events listed under the tabs here on the right side of the page. As you can see, the report launched last year and the report we're launching today can be found under the Publications tab here. And today's event, as well as our past events, can now be found under the Events tab. And as mentioned by my colleagues, this report we're launching today comes with a digital supplement which houses all resources and references collated by our team. By clicking on this tab here, you'll be able to access the supplement. You will find several resources from different references, all of which relate to pandemic preparedness, response, and recovery. As you can see, you will find resources from the World Health Organization, resources from other health professions, resources from other pharmacy organizations, as well as research references and resources from around the world, including news and events. This digital supplement will be continuously updated with new resources and references that will hopefully serve as a platform to foster a more resilient and prepared global healthcare system, particularly for pharmacists, for the challenges of tomorrow. For more information, please visit our website, humanitarian.fip.org, and find everything we just mentioned on the pandemic preparedness page. Thank you.
Thank you very much, Nour, for sharing our digital supplement on pandemic preparedness. And I believe that Nour actually posted in the chat as well the link for the digital supplement. Thanks, Nour, for that. And
hello everyone.
Okay, let's now move on to our next session, which is our keynote presentations. And I would like to introduce Dr. Caitlin Watson. She's the founder and chief executive officer of Disaster Pharmacy Solutions. And she's also the assistant professor of Faculty of Pharmacy and Pharmaceutical Sciences, University of Alberta. And I would like, Caitlin, thank you so much for already opening your video. And welcome, and I will give the floor to you now. Thank you.
Thank you so much, Sherly. So thank you everyone for having me speak this morning. So I'm presenting from Edmonton in Canada, which is located on Treaty 6 territory. And I just wanted to spend a few minutes speaking about how pharmacy is the answer to pandemic preparedness, response, and recovery. So on the next slide, please, is firstly, let me introduce you to the Sendai framework for those that may not be aware of it. So this is an international agreement that was ratified in 2015 by 187 countries who have all agreed to take actionable measures to meet the specific outcomes, to reduce the impact of disasters and health emergencies on the loss of life, livelihood, and health of our communities and countries. It is one of 3 landmark agreements of the post-2015 developmental agenda, which includes the Sustainable Development Goals and the Paris Climate Agreement. So the Sendai framework offers governments the opportunity to enhance their disaster risk reduction capabilities by ensuring a role for multi-hazard management of disaster risk in all countries at all scales and across all sectors. So this framework has had a keen focus on protecting individuals' rights in terms of health and well-being, and in doing so aims to protect their individual human rights. There are 7 goals that we are all working towards, because a lot of our countries have signed on to it, and they're in the figure here on the slide. But the Sendai Framework 4th global target articulates that sustainability for substantially reducing the disaster damage to critical infrastructure and disruption to basic services, and among these are health and education facilities, including the development of their resilience by 2030. So this framework is really important for us to understand because that's what we're all currently working towards. And pharmacists, I believe, are the key to achieving these actionable outcomes. The Sendai framework suggests that for disaster risk reduction to be effective, emergency management should be inclusive and multi-sectorial. It lists both community and healthcare professionals as key interested parties. This includes the pharmacy workforce. We are a big component of our communities, and we are vital for its resilience and recovery from emergencies. On the next slide, please. So priority 3 of the Sendai framework relates to investing in disaster risk reduction for resilience. And they state to achieve this at the local and national level, we need to have a commitment to health resilience. And so this includes promoting and enhancing the training capacities in the field of disaster medicine or disaster health, and having inclusive policies that facilitate access to basic healthcare services. So this commitment to build health resilience includes people with life-threatening and or chronic conditions. Priority 4, which is here in the grey box on the slide of the Sendai framework, focuses on enhancing disaster preparedness for effective response and recovery at the local and national levels. And they state to achieve this, we really need to promote that resilience of new and existing infrastructure, including water, transportation, telecommunications. But what's key is our hospitals and our other health facilities to ensure that they remain safe, effective, operational during and after disasters in order to continue to provide the life-saving and essential services that they provide. So this priority really suggests that there needs to be a strengthening of our health facilities to remain operational, but it also includes medication continuity of care provided by our pharmacists in our pharmacies and hospital departments. There is also a commitment to train and strengthen the logistical capacity in emergencies to ensure that our teams that are responding can provide the best response to meet the demands. Next slide, please. So why do I believe that the Sendai framework is so important for us to know as pharmacists and pharmacy associations and organizations? Well, 2 of those 7 global targets or goals are to reduce the mortality rate and the number of disaster affected people. Well, pharmacists are key to being able to do this. We are the most accessible healthcare provider around the globe. We're the 3rd largest healthcare provider. Therefore, if we include in our profession in disaster management, it has the potential to really help countries meet these Sendai framework goals. Including us in all of these aspects of disaster management and emergency preparedness really offers the wider network of healthcare facilities to provide the suggested basic healthcare services within an affected country or community. Additionally, we all have recently experienced, and what we've been talking about with the COVID-19 pandemic has really shown and highlighted, as we've heard in this report and the case studies from the different member associations, how pharmacists were the key health profession in the fight against pandemics, as well as how vital we are in terms of other public health and health emergencies. Research has also proposed that pharmacy is often the first medical entity that returns to operations within a community after a health emergency has been impacted in them. Lastly, pharmacists have been identified as a really trusted health resource. This goes beyond, and what we've shown in COVID-19 with some of the research that we've done is it's not just drug information and drug expertise that we have previously been known for, but people are coming to us in our communities because, one, we're a safe haven, we're a trusted resource, we're someone that they're familiar with going, but they're coming to us for reliable information during a health emergency. And this goes beyond just drug information. I'm sure many people experience this during the COVID-19 pandemic. And then a couple of other things that are on the slide here is where pharmacists are already embedded in our communities. We're on the front line of continuity of care. And the COVID-19 pandemic has really highlighted how valuable pharmacists is and how we are able to help reduce the mortality and disaster affected individuals by being more included. Next slide, please. So just in a couple of next steps for us all to consider. So the first thing that I would like us to consider is contributing to the literature on the lessons learned and the challenges faced by the profession. It's really important that we get it documented, one, how amazing pharmacy did in every region and how they were able to help, but also what were the challenges that they faced and what are some potential solutions that we could look at next time. And that's what definitely this pandemic report helps contribute in that space with the case studies. The second thing is around raising awareness and acceptance of pharmacists' public health role. I did find that the research that I did prior to COVID-19, it was quite often less accepted that pharmacists had a public health role, when now I find that the pandemic has really highlighted, one, how valuable pharmacists are in this space, and it's now accepted that pharmacists are public health pharmacists. All pharmacists are. We all have to step up in a pandemic. We all have to be available and play our part. And so just raising that awareness, raising that acceptance, and keeping that momentum going on the tail end of COVID. The third thing is advocating for the full integration of pharmacy and the pharmacy profession in pandemic and health emergency preparedness. It's been really amazing that we've been able to have very good representation at the international and national and local level in response and reacting to the COVID-19 pandemic. And we were able to get pharmacy represented on many different committees and different tables within our countries and in our regions. What I want to suggest and what I encourage you all to do as next steps is to make sure we hold on to those seats. Make sure we remind everyone that's in this space how valuable pharmacy is and why we need to be included from the very beginning of pandemic preparedness as well as health emergency preparedness, and that it's not just to bring us in at the late stage of the response, but we need to be there when the health decisions being made as to how are we going to respond, who needs to be involved, what needs to happen. We need to be a part of those decisions. And then the fourth thing is participate in preparedness activities. And this can be both on the individual level, on the organization or associate level, or in a group, in your team in different capacities, is to really make sure that you're comfortable within yourself to how you can personally as well as professionally respond to a pandemic or health emergency in the future. And the great way of doing this is in safe learning environments where you're able to practice these types of activities, whether it's exercises, drills, or simulated scenarios. Test your ability to respond, test the disaster plans and the pandemic plans that your facility might have, and find the weaknesses and strengthen them in preparation for the next event. Because it's not a matter of if we'll face another health emergency, but when. And so then just on the last slide, I want to leave you with this quote from the Global Assessment Report of Disaster Risk Reduction, is sustainable development cannot be achieved unless disaster risk is reduced. And I would be happy to answer any questions that anyone have or connect at another point. Thank you so much.
Thank you very much, Kathleen, for sharing your presentation about that pharmacy is basically the answer for everything. So that's very, very, very comprehensive presentation. Thank you so much. And let's just move on now. I would like to share the response that we gathered from the audience today about the 3 words, and I hope all of you can see it now. Thank you so much for all of your feedback on the 3 words that describe the impact of pharmacy on pandemic preparedness. And we can see here is very, very comprehensive actually overview of the impact of pharmacy. And I can see words like essential, always available, collaborative, adaptive, life-saving. It's a really, really good. And we'll make a note of these 3 words, and this will be very useful as well for us. Thank you so much, everyone. And let's move on now, perhaps to the next session, which is the panel discussion. And I will give the floor to my colleagues, Farah and Lina.
Thank you. Thank you, Sherly. If we can stop sharing the slides, I'd like to invite all panelists and our keynote speaker to join me on screen. Again, welcome to our 10 esteemed panelists and speakers representing diverse backgrounds and expertise. Just taking into consideration the time we have, we would like to kindly ask you to limit your answers to 1 or 2 sentences, please. We will take 10 minutes, the next 10 minutes, going through 2 main questions. And we will divide those between the panelists we have on the screen. So first, let's steer the discussion towards understanding the priorities and the strategies that should guide our profession in the face of future pandemics. My question is, what, in your opinion, are the top 3 areas of focus for pharmacy when it comes to pandemic preparedness, recognizing, of course, that these may vary based on regional contexts and needs? And we will begin with Caitlin. Over to you, and then Ro.
Thank you so much. So I think really the key that I just mentioned around participating in health preparedness activities is a really vital way that we can all increase our individual capabilities, our willingness, our comfortableness in being able to respond, as well as our teams, the people that we manage, our associations and our groups. So I think that would be my top one. And then the other 2 would be contributing to the literature. We need more evidence around what the impact of disasters and health emergencies and pandemics are on pharmacy, as well as how do we respond, what are the challenges that we face, what support do we need, both from within our pharmacy world, but as well as the broader context in terms of disaster responding. So I'd say they are my top 2. Thank you.
Thank you very much, Caitlin. Moving on, I'd like to invite Ro, then Rooney to share their perspectives on the same question. Ro.
Hi. You said Ro, right? Hello.
Yes. Yeah.
Yeah. Okay. From my perspective, the top 3 areas are like an understanding of the impending danger, along with precautions to stay infection-free. That is very important for the pharmacist to know, because if it's a pandemic situation, then we need to understand what's danger and what are the precautions to stay infection-free, not only for them, but also advising the patients. And also, in any pandemic, pharmacists are supposed to understand the emerging treatment guidelines to manage the affected, and to procure stock and dispense those medicines. Because if there are treatment guidelines and pharmacies do not have those medicines, then it's no good. So that's where pharmacist role comes really. And third is the developments in vaccines and to be ready to procure and vaccinate general population to arrest the progression of the pandemic. I mean, these are the three different areas which, in my mind, are essential. Thank you.
Thank you very much, Ro. I'm going to hand it over to Rooney now, and then Susan.
Great, thank you. Eventually, based on the report and based on the information we faced during the pandemic, I definitely agree with all of you. However, I'd like to add that we need to introduce something related to preparedness and the curriculum of the pharmacist to be, and the curriculum of the new generation, and in particular to forge the concept of how to fight misinformation. Probably we cannot anticipate what the next pandemic would be about, but we really need to help, and we need to educate our new generation how to fight against misinformation. This is one primary concept that we really need to focus our priority on. Definitely, you've alluded to the fact of orchestrating resource sharing, and this has been done by FIP new report, and this is something very essential across organizational state. And finally, I'd like to highlight that synchronizing communication is also important, because we've seen a mess during the pandemic, and we need to lesson learned from this behavior that we've all have done, and we really need to orchestrate, and probably FIP can lead on this factor. And definitely I agree that we need more evidence for future. Thank you.
Thank you, Rooney. Handing it over to Susan and then Carla to address this question.
Hi, hello. Yeah, I suppose the three areas of focus for pharmacy when it comes to pandemic preparedness would be to be in possession of professional factual advice. And then moving on from that, just having structures in place for the management of medicine supplies and building and advocating for future systems that have resilience with the supply of medicines. And then having a skilled workforce who can upskill and can expertly provide point-of-care testing, like was seen with the provision of vaccinations and also antigen testing.
Thank you, Susan. Carla, over to you.
Thank you. So if I must only choose three areas of focus, I would say accessibility to treatments, immunization, and health literacy. Concerning the accessibility to treatments, it's fundamental to guarantee access to medications, not only in time of crisis, but any time. And it should include a strategic reserves of medicines. Preparation is essential to act instead of react, so extremely important to have a well-defined national and international strategy to take action when necessary in the most articulated and agile manner as possible, and using the available resources in a sustainable way. Concerning immunization, expanding the access to vaccines, including community pharmacists at vaccination points, enhance convenience and can reach remote populations and increase vaccination rates. And this year, for the first time, the Portuguese pharmacists will vaccinate against COVID in the campaign promoted by the Portuguese National Health Service. And about the health literacy, anyone at any age, at any time can walk into a pharmacy and have their concerns addressed. So pharmacists often see their patients more than any other health provider. So in case of a pandemic, they can foster trust in the healthcare system and provide tailored communication strategies to promote health literacy and address vaccination hesitancy. And that's it.
Thank you so much, Carla, and thank you, colleagues, for your insights. I will move us forward with the next question about what can FIP do to support its members and the profession in terms of pandemic preparedness. And I will hand it over to Rote to address this question, and then Nabu.
Thank you. Farah, responding to your question, FIP's role in supporting its members and the pharmacy profession's preparedness for pandemics can be summarized in 5 key initiatives. Firstly, knowledge dissemination and training. FIP can organize webinars, workshops, and conferences with the participation of experts, practitioners, and researchers to share best practices and insights on pandemic preparedness. This includes training programs for pharmacy professionals covering vaccination administration, public health communication, and crisis management. Secondly, we have advocacy and policy influence. FIP can use its global influence to advocate for policies that empower pharmacies in pandemic response. This involves fair resource distribution, favorable regulation, and integrating pharmacies into national and international plans. Thirdly, resource sharing and networking. FIP can establish a platform for sharing resources, guidelines, and best practices related to pandemic preparedness. This could provide access to up-to-date information, communication materials, and practical tools for pharmacies to implement effective preparedness measures. The fourth initiative is research and innovation support. FIP can fund and promote research projects focused on pandemic preparedness within the pharmacy field. This can contribute to evidence-based practices and innovations that enhance the profession's response capabilities. And finally, we have capacity building and low resource settings. FIP can extend its support to pharmacists and pharmacies in low resource settings where pandemic preparedness can be particularly challenging. This ensures that pharmacy professionals worldwide are equipped to contribute effectively to pandemic preparedness. And in conclusion, FIP can serve as a catalyst for enhancing the pharmacy profession's role in pandemic preparedness through knowledge sharing, advocacy, resource allocation, research support, and capacity building. This empowers members to play a vital role in responding to future pandemics and public health emergencies. Thank you.
Thank you, Rote. We'll now hear it from Nour and then Sophia.
Thank you so much. So it's my personal idea, so that although it is not possible to give a uniform approach as law and regulation differ from country to country, it would be very useful to get guidance or interaction control and up-to-date information that vaccination are provided. And we hope that the information will be provided in Japanese, because the Japanese people that's not easy to understand English. So it's the most important issue, I think, that the global information to provide in Japan with the Japanese version. Thank you very much.
Thank you. Now Sophia and then Marian.
Okay, thank you very much. I think that we all have that a very comprehensive view about FIP, what can do. But I would like to say that we need to remember that we should work together. We need to work together in national and in an international way, because we learn from others. So in that case, we need to keep on working on this kind of events where we can share our experiences and our projects. Also, we should not forget that FIP must continue to promote good pharmacy practices, since good professional practice favors correct preparation in emergency situations. We should not forget that. And we must continue with the development of periodical publications to have an updated and contextualized information. And last but not least, I think that FIP should continue supporting member organizations in the development and evaluation of projects aimed at generating an impact on the public health of population. Thank you very much.
Thank you, Sophia. And I just want to announce that we will extend the event for 5 more minutes in order to conclude the panel discussion and have the final remarks at the end. I'm going to hand it over to you, Mary, and then Jackie.
Okay, so FIP online support to its events and documentation, etc., is crucial. More dissemination of individual member country successes would help in learning from peers. FIP's representation at global, regional levels is remarkable. The FIP development goals are a beacon to guide members to adapt and implement necessary changes for preparedness. So FIP's increased interaction at national level with pharmacy leadership and members could assist in bringing about desired change and spearhead development in this area. Thank you.
Go ahead, Jackie. Thank you, Marianne. Over to you, Jackie.
Thanks very much. Yes, I think everybody has covered everything there, but if I can just really, coming from Africa, really highlight the capacity building in developing countries. I think FIP is a wonderful platform for the developed countries to really showcase best practice and share that with us as we capacity build in the developing countries. And I really think FIP, with your global view and your influence and your advocacy, can assist with that. Thank you.
Thank you very much. And finally, Caitlin, to conclude the panel discussion.
Thank you so much. So I love everything that everyone said, and I think it's really important that we talked about, curriculum, research, education, working together, and all those aspects. I think the last thing that I would add is making sure that we're not focusing only on pandemics, but focusing on all health emergencies. Pandemics is one of many different things that can impact our pharmacies and our pharmacists that they need to respond and adapt their regular roles to. So making sure that we're prepared for pandemics, but also all hazards. So all types of health emergencies that are going to impact us, or infectious disease or different outbreaks and things like that as well. So thank you so much.
Thank you, Caitlin, and thank you very much to our panelists for the insightful panel discussion. As we reach our closing remarks, if I can ask Sherly to share the last slide. We would like to share with you 3 important quotations from Dr. Tedros, the Director General of the World Health Organization. These quotations serve as a powerful reminder that while we may navigate through the challenges of current pandemics, our journey towards pandemic preparedness does not end here. We must remain proactive and committed to ensuring the readiness of our healthcare systems and the resilience of our communities. The end of COVID-19 as a global health emergency is not the end of COVID-19 as a global health threat. The threat of another variant emerging that causes new surges of disease and death remains, and the threat of another pathogen emerging with ever deadlier potential remains. Pandemics are far from the only threat we face. When the next pandemic comes knocking, and it will, we must be ready to answer decisively, collectively, and equitably. We urge you, colleagues, to take these words to heart. Let us continue to learn and implement strategies that will also reinforce the role that pharmacists play in safeguarding public health. We will now stop sharing our slides, and I will invite all panelists, speakers, moderators, and facilitators to go on screen as we say goodbye. Thank you for joining us, and thank you for staying with us up until the end of the event. See you soon.
Thank you, everyone.
Good night. Thank you. Good night.
Bye-bye.
Bye.
Bye.